Well, so January is Cervical Cancer Awareness Month, and that is why we are taking action this morning with what you need to know about the disease and how it can be preventive. So Dr. Katie Bright from Bayless Integrated Healthcare is here with us this morning with more on what we need to know. So thank you for waking up bright and early.
Thank you for having me.
We want to get into this here. So what exactly, for people who may not know, what is cervical cancer? Is it just kind of how it sounds?
Yeah, so it is. It's cancer of the cervix,
Okay.
which is a female part of our reproductive organs.
Yeah.
And it's an important one because we have great screening strategies, and I'm happy to be here to talk about it.
Yeah, for sure. Now, for people who may not know, what could be some of those symptoms, maybe that something has gone a little wrong?
Sure. So we hope that we never even get towards the cancer phase, but a lot of times cervical cancer is asymptomatic, so no symptoms at all.
Wow.
And that's why the screening is so important.
Yeah.
But what we most often see when women do have symptoms would be bleeding,
Okay.
so vaginal bleeding, particularly after intercourse. So definitely, if that's happening, it's something to come in and get checked out.
Okay.
Sometimes there can be a little bit of pelvic discomfort or swelling.
But as you mentioned, you hope it never gets to that phase,
Right.
because there are so many things that we can do, those preventative measures. So kind of walk us through those first ones, those initial ones. Is it just going for that yearly exam?
Yeah, I think there's actually 3 really important preventive strategies.
Okay.
And it's important because in the rest of the world, cervical cancer is still a big cancer killer for women.
Yeah.
One is that we have a vaccine, which
Okay.
is amazing, like a vaccine
Yes.
that prevents cancer. So that is approved for boys and girls starting at age, well, it's 9 for girls, and we usually give it for boys and girls starting at age 11.
Okay.
And because they get other vaccines then.
So that's one line of defense.
It's
is
one
having
line of
that
defense,
vaccine.
and the good news is it's approved to 26 for women, and now we have it FDA approved for 26 to 45-year-olds.
Wow.
So even for
opening up, yeah.
those of us like me that are in that category, it's opening up to even a broader age range.
So what about the second one?
The second one is your pap smear. So no one loves getting in stirrups. I know it's not our favorite exam, but it's a really important way to screen for cervical cancer.
Sure.
And because we co-test and we look for HPV now too, besides on top of the pap smear, the good news is it's only every 3 to 5 years.
Yes.
So less stirrup time for women.
Sure. Yeah, that's
great.
something I think that can be a hindrance, that they just don't feel comfortable.
Right.
But the good news
But
is
it's
that
so important.
change has happened.
Right.
Okay, and what is the third one as we wrap up here?
The third one is smoking. So it's a lifestyle intervention.
Wow.
So those of us who smoke have a much harder time clearing the HPV virus and progress to cancer more readily. So it's really important. Hopefully, if anyone's contemplating quitting,
Yeah.
maybe give some motivation.
Here's another incentive, right? I mean, there are so many.
There's
a
so
long
many.
list. All right, Dr. Katie Bright, thank you so much for being here. We really appreciate it. Again, don't forget, it is Cervical Cancer Awareness Month. There are things that you can do to take care of yourself and take your health into your own hands.
Thank you for having me.
Thank you.
All right, thank you, Al.